Assalamualaikum, Madam Azita Luli. My name is WAHEEDA binti ASUAD. Student ID 2024289278.
My name is SITI AFIQAH binti ZAKARIA, and my student ID is 2024289956.
Assalamualaikum and hi everyone. In this video, Afika and I will be discussing an important study about health insurance affordability concerns and how these concerns are linked to healthcare avoidance among adults who are approaching retirement. This topic is very relevant not only in the United States but also for many countries, including Malaysia, where people face rising health costs at stage age. The purpose of this presentation is to understand the background and context of the issue, review the research conducted by Tiperini and her colleagues, highlight the key findings, discuss the implication and provide recommendation, and conclude with lessons that can be applied to health insurance system in other countries. Let's begin with the context. To start, let's understand why this topic is so important. Adults aged 50 to 64 are in critical transition phase approaching retirement as their health risks increase and healthcare costs and insurance premiums continue to rise. According to the study, 27.4% of adults reported having little or no confidence in being able to afford health insurance and out-of-pocket costs in the next year. Even more striking, 44.6% had low confidence in their ability to afford insurance after retirement. In addition, about 67.7% of respondents were very or somewhat concerned about potential changes in federal health policies that could affect their insurance coverage. These affordability concerns lead to two major issues. First, some people delay retirement or stay in their jobs just to keep their employer-sponsored insurance, which is a phenomenon called job lock. Second, others avoid healthcare altogether, like skipping medical visits or prescription because they cannot afford them. This behavior has serious consequences both for personal health and for the healthcare system. Now, let's focus on research itself. This study by Tiperini et al. 2020 was a cross-sectional survey conducted in October 2018 using the Ipsos Knowledge Panel, a nationally representative online panel of US adults aged 50 to 64. A total of 1,028 respondents participated, with an average age of around 57 years. The study measured several key factors. First, confidence in affording health insurance and medical costs in the next year and during retirement. Second, whether respondents kept working or delayed retirement to maintain employer insurance. Third, concern about potential changes in health insurance policies. And fourth, whether they had avoided medical care or prescription medication due to cost. The researchers then analysed the relationship between low affordability, confidence, and the likelihood of avoiding healthcare.
The discussion highlights that adults aged 50 to 64 years in the United States face significant health insurance affordability concerns, which are linked to avoidance of medical care, including prescription medication. Additionally, health insurance affordability issues may not only affect physical health but also influence the capacity to work or retire. Many adults in this age group are uncertain about whether they can afford medical expenses during retirement. According to data from the Employee Benefit Research Institute in 2019, 41% of workers were not confident that they would have enough money to pay for healthcare after retiring, and individuals aged 50 to 64 spent around 10% of their household budget on healthcare. The study also found that concerns about affordability are related to retirement, timing, and job flexibility. Some adults delay retirement or continue working mainly to maintain employer-sponsored insurance, a phenomenon known as job lock. Around 14.1% of respondents aged 50 to 64 reported keeping a job for this reason, while 11.4% delay retirement to retain their insurance coverage. This demonstrates that insurance affordability concerns indirectly affect labor force participation and not emotional well-being. Overall, the result indicates that improving health insurance affordability could help reduce care avoidance and provide older adults with more flexibility to retire or change job without fear of losing insurance coverage. To address the issue of health insurance affordability and healthcare avoidance, several actions can be taken. First, the government and healthcare providers should organize educational programs to raise awareness among adults approaching retirement about available insurance options, healthcare costs, and the importance of seeking timely medical treatment. Second, insurance companies should introduce simpler, more affordable and flexible insurance plan for individuals aged 50 to 64 so that they are not forced to avoid medical care due to high expenses. Third, policymakers should provide stronger policy support and consider offering subsidies or financial assistance to help low-income or high-risk individuals afford their insurance premium and medication. Lastly, expanding access to telehealth service and low-cost community clinics can reduce financial barriers and encourage early treatment, preventing minor health problems from developing into more serious conditions. In conclusion, the study highlights a serious issue faced by adults approaching retirement, which is the concern about health insurance affordability and its direct impact on healthcare avoidance. Many individuals in this age group, which is 50 to 64, worry about their ability to afford medical expenses, which often leads them to delay or skip necessary treatment and prescription. This situation not only threatens their health but also increases their potential burden on the healthcare system in the long term. Therefore, it is crucial for government, policymakers, and insurance providers to work together to improve the affordability, accessibility, and understanding of health insurance options to ensure that everyone can receive the medical care they need without financial hardship.